Hello everyone and welcome to this webinar. There's a very important and ongoing challenge that we all are facing since last year, the COVID pandemic. And now the cases have started dropping, but at the same time, there's a lot of speculation about infections rising again the moment restrictions are lifted. There's still no confirmation about vaccines available for kids, and this makes it all the more trickier. Everybody wants to ensure that our children are safe and away from all kinds of infection. Parents associated with Kids Castle are very keen to know what all precautions to take or what to do to boost our kids' immunity. Whether to make changes in the child's diet, which food to completely avoid. And there are so many questions that keep popping up. How to ensure proper growth and development of young children as they are at home 24/7. To discuss all this and much more, today we have on our guest, Dr. Vishal Rao. He will share with us his knowledge and practical tips for responsive parenting during these times. We also have our founder director, Shweta ma'am, and Anuj sir, managing director. Their priorities are right now only one, the wellness and precautions for our children during the COVID times, and how to equip our child against the deadly coronavirus. Welcome, sir. Welcome, ma'am.
Hello, Simple ma'am.
Hello, good morning, ma'am.
Dr. Vishal Rao will join us soon. Sir and ma'am, as we all know and we have discussed also, the deadly coronavirus is impacting the young students' growth and developmental. Everything is being impacted. There are shutdowns, lockdowns. Parents are confused. So, sir, any input from your side for our young children?
Ma'am, yes, this COVID has been the burning topic right now. Every parent is looking out to know that how to protect their children against the COVID, right? And there are instances and there are examples coming up where the children are getting impacted because of COVID. But yes, to an extent, these cases are not alarming as of now, even though there are some talks about that, third wave will have an impact on children, but how much it is true and how much it is conclusive, how much it is report-based, nobody is aware of that. But yes, it's better to take precautions right away and ensure that the immunity of our children is better to protect us from the COVID. And for that, Dr. Vishal is going to join us today and give us some inputs that is really COVID, going to impact children very seriously, or is it really a cause of concern? We should be really careful about it, or what should we definitely we should be careful about it, but how we can avoid it, how we can build up our immunity, what best practices we can take up to ensure that the children are not impacted because of the COVID. So we'll wait for Dr. Vishal to be here and share his inputs. I'm sure that there's a lot of learning which is going to come up our way right now from this session, and we'll see what Dr. Vishal gives us inputs.
So, if school opens anytime soon, what kind of precautions would be necessary?
Shweta, would you like to take that?
Yeah. So school opening sounds good. Okay, so everyone, parents, teachers, kids, everyone is looking forward for it. Everyone is waiting for it. So our campus are pretty ready. We have not closed down any kind of a campus. Kids Castle has not done it. So our campus are ready. Once we get a news of school opening, we'll definitely first work on the sanitization of the school complete, and then kids would be called on rotation basis for a short duration and less number of kids at a time. It's not all together. I think Dr. Vishal has joined. So
hello
sir, good morning.
Hello, Dr. Vishal.
Good morning. Good morning, Anuj. Hi,
Hello.
Simple.
Hello, sir. Hello, doctor. So here we have Dr. Vishal Rao, our guest for today's webinar. So let me give me this opportunity of introducing him. He is MS FRCS from Glasgow, FACS USA. Dr. Vishal is also the Dean of Center of Academics and Research, Healthcare Global, the HCG Cancer Center. Dr. Vishal is a member of Karnataka COVID Task Force, And he's also a member of consultative group to principal scientific advisor to PM, Government of India. So welcome, Dr. Vishal, on our webinar today. Our parents have a lot of questions, and I'm sure your insight and whatever you have to discuss with us will give them a proper input about these COVID times and what to do to build their child's immunity.
Thank you. Uh, uh, Thank you, Shweta and Anuj, for this opportunity. I think when we first connected on this, I think it was a general casual discussion between me and Shweta about how our school's doing. And I'm seeing that has ended up into this webinar today, because I think we debated on a lot of issues. It was more of a conversational dialogue between both of us that came out as a narrative to say that we need to look at this. And at that time, I was sharing with her the ongoing discussion among global bodies, WHO, between the state governments, and general interesting debates. And what I found very interesting, what she gave me her perspective from the Castle group and from what you all are doing, was for me very insightful to understand the perspectives of parents, the perspectives of the children. And I also communicated that to our education minister, Shri Suresh Kumar, kind of giving him a shared insight to saying, he already had a year on the ground, he did understand it, but I felt good to share some perspective with him to understand his views on these and what are the concerns from their side. And we keep interacting on this discussion on a very regular basis. And I also hope that in this discussion that we're going to be doing today, I'm going to take more insights to the government, talk to them on both sides to get what shared perspectives we need to look at and how do we address these. So my intent is not to keep a one-way dialogue here or a monologue, but to also have our parents, teachers, or even the students interact and tell us what they feel, what's the ongoing condition. So what I thought, Anuj and Shweta, I've got some few slides to share, which I thought would bring some perspectives to the discussion. And based on that, we can maybe take questions and keep interactions on. If you could allow me to share my screen.
Yes.
Sagar, please share the hosting rights.
So what I put through as a part of these slides, if any of these parents have doubts, they can put the questions in the chat box, or you can maybe ask them to stop us in between, because this is not like a formal lecture. I've just put some slides to kind of stimulate the thinking, touch on controversies. I cannot assure you that there will be no controversy. There will be controversies in each of these slides, but definitely there is a need to, I think, discuss these controversies and address them. And there is no single mantle of black and white in this today. There are many shades here which we still haven't understood. So I'm going to open it up with that. And I'm going to share some of the recent talks that we did and also tell you what we did. So I've called this the World War C. It couldn't be better described, because it was nothing less than a world war that affected the entire globe, 200 countries across the globe. And I'm going to share a little perspectives on the scenario in India. I'm representing HCG. HCG is a chain of cancer center, but we also have a presence in fertility. We have a presence in precision medicine through Strand, and we have a group of general hospitals. We are currently at about 26 centers across the world, and I'm presently based out of Bangalore. Our model has been studied by the Hub and Spoke by Harvard Business School. And I head the Center for Academic Research and also been a part of the state government in two capacities. One is in the expert committee for the task force, and also with the genomic surveillance committee, which is going to be playing a very active role for the third wave, to look at how we can track, prevent, and predict the third wave better. Quite emphatically, I use this often in the beginning to say that Winston Churchill during the World War II told something very interesting about Russia. He said it's a riddle wrapped in a mystery within an enigma, but perhaps there is a key. I cannot agree more for this context of COVID. The reason being, today global bodies, international bodies, governments have all not been able to decode this. The biggest group of scientists virologists, epidemiologists, clinicians, pulmonologists, intensivists, all put together. Everybody is working towards decoding this mystery. And this quite often reminded me about the Winston Churchill's world and how apt it is for today. So based on this, I actually wrote this op-ed, and I'll share these links with Shweta as we complete the presentation, so that you could actually, if anybody is interested, read these on the perspectives of the World War C. You see, India's numbers were rising, and I'm just quoting some old figures, but primarily what I wanted to share with you all is this graph has been rising, and I'm going to share a little bit of perspectives on the number of cases, the deaths that has happened, and recovery. While we've all been reassured that the recovery rate is excellent, what we need to understand here is that small percentage of the people we talk about mortality, which is at 2% or 1%, were actually humans who lost their lives, and they were in thousands and lakhs. So while the percentages are reassuring, the reality is very, very depressing. The reality is very unnerving. And that is what we saw through this entire pandemic. Dane, looking at the way the jump was, we finished the first wave, then we went into the second wave. And I'm going to give you all a little bit about the understanding between these waves. And one of the most important things I want to focus is this, the gap, the plateau between the two. Now, oftentimes when we see this plateau, there is an assumption that there is a sense of celebration, and that's what we are in currently. Yesterday, I was at a panel discussion which India Today had called us for on COVIDiots. Very interestingly, which actually talked about this particular group. In this particular group is when the COVIDiots come out, and they actually create this. And very interestingly, they did some sting operation, and they did some thing in Delhi and a couple of places to see how the city's economic hubs were bustling with activities. Now, what I wanted to tell you out of this graph is not to give you a detailed statistical note, but to give you a simple indicator to express that between these two waves, we all hear about the first wave, the second wave, the third wave. Remember, these waves are created by us. And as we create this wave, you see this plateau that it suddenly dips down. Now, roughly this happens every 3 months. So if you look at very rough statistics, it takes about 3 months to climb, then 3 months to come down, and 3 months to start again. So it's a 3-monthly cycle that's happening on an average globally. Now, this is largely dependent on patient behavior, number one. Number two, based on the new strains and mutations that are happening. That means at least every once in 3 months, you are seeing a new variant come up, which is more aggressive than the previous one. That makes it more transmissible, makes it more fatal. And that's why you have to understand that beyond our own thinking, we cannot assume that we have conquered this entire thing in a sense of just expressing to say that we will all come out and do it. Now, why am I saying so? If you see the genomic landscape of the changes of this virus has a very rapid mutation rate. Like any other RNA viruses, they tend to mutate fast. And every time you don't kill it, it gets stronger. So which means it every time is using your own machinery to get stronger. And the importance here is in this gap that it is not that the virus is sitting quiet and taking rest. Please note that this graph where you see the plateau is not the time where the virus is taking rest. It is the time when you are actually behaving properly or where you are under lockdown. And that's why the moment your behavior changes, you will see this jump. And this is time and again noted in most of the studies globally that it is you who are moving the virus and not the virus moving on its own. It doesn't have hands and legs to move. It uses your machinery, your hands and legs to move around. And in this particular aspect, if you want to maintain your graph here, you need to understand that COVID appropriate behavior is going to be the most crucial. And I'm just going to sum it up into 2-3 key points. One is that you have to look at mask, which is your first vaccine. I prefer to say that the second vaccine would be yoga, just simple good breathing exercises. And the third is your jab. In that order of preference, please learn this, that these three are going to be useful. They're going to be very useful. As healthcare workers, 1 year from March 2020, we've lived without a vaccine. in the COVID wards, treating COVID patients, treating cancer patients, doing our routine activities, carrying on, helping government. We did our thing without a vaccine, only because of a mask. So I know for a fact that it is as powerful as the first vaccine, that you need to prioritize it. The second thing, now if you look at the discharges, and I'm just giving some figures from 13th, if you look at the latest one, this positivity rate, I'm pointing out to point number 8, positivity rate for the day is now less than 5% in Karnataka. However, that should not reassure you to say that we won, because I wanted you to again focus on the total number of active cases. At currently, it's at about 1.5 lakhs. So there are still 1.5 lakh patients who have the potential to infect others, who have the potential to spread the thing, who are not necessarily in the hospitals. And at this juncture, every new case is still at about 5,000 new cases reported. And the death rate is still at 2%. 2% of the population are going to die. Now remember, when you're talking about a 6 crore population, a death rate of 2% is very dangerous. It still means thousands and thousands of people. So do not get reassured with this percentage that, oh, it's a very small percentage. No, the sights that we doctors saw during this particular pandemic for us has left a very deep psychological and an emotional impact in our lives. For my colleagues whom I have seen carrying their a patient's dead body, to I have seen a husband come carrying the wife, I mean bringing a wife on a wheelchair with both gasping, with black fungus, with absolute things. And I believe at one point that our responsibility also lies with not telling our government to create a bed, but also to prevent that bed. Because no healthcare system of this world is geared up for managing a pandemic of this particular number. It is not geared up. So whether anybody assures you or not to say, don't worry, go out, do not do it, because this is a socio-economic virus. The more social activities, the more economic activities, the more this virus will spread. So how are we going to deal with this? So I had written an op-ed on this, and Shweta, I'll share that with you all, on how Singapore used the end of the circuit breaker model. This particular model actually talked about 3 phases. They said safe reopening, safe transition, and safe state. 3 phases. In the first phase, the safe reopening phase, you keep the positivity rate at below 5% and only open economic activities and not social and entertainment activities. And schools comes under the aspect of the economic activities, a small aspect of it. Now, the reason for that, not because it's an economic activity, but it's an important social need. And that's what was discussed about how to reopen them in a very balanced way, which category to look at. But broadly to say, in that category of economic activity, also focus on daily wages. 70% of India's population is daily wages. Focus on them so that they can eat their daily bread. Second, after that, look at the month-to-month people, an average middle-class man who has to pay his EMI, who has to pay his rental, who has to survive for his family. That person has to be given the next focus, and year to year later. And in this way, to look at a slow opening. And as you move towards safe transition, you slowly start opening social and entertainment activities, very closely watching the 7-day moving average. So I showed in the previous slide here, the 7-day moving average is very, very crucial to watch. If the 7-day moving average of the total positivity rate is still below 5%, then you are on the safe ground to open slow amount of social activities and entertainment activities. If you do not follow this, then you will fall short. Then the last phase, which is the safe state, only happens when you reach at least 60% of vaccination for the state. Now here it is very important to understand, in Karnataka, for example, 80% of the population is below 45 years age group and 20% is above 45 years age group. Now in this age group, if you look at the numbers, our vaccination rate is still at about 55 odd percent or 58% for above 45 years age group, who comprise of only 20% of the population. Whereas in the below 45 age group, our current numbers show that we are only at 10%. That means only 10% of the people have at least taken 1 dose. And 0% have taken the second dose. So we are a long way to, and below 18, we do not have a vaccine now. So with this in mind, I just wanted to stimulate your thinking to discuss and say that look at this, and why am I calling this the World War C? Because a few grams of this virus actually stopped the world. Think of it, this virus weighs about 0.85 attogram, and a few grams of this virus across the world has stopped the world. It has just completely stopped the world. So that's why I'm referring to this as a World War C, because this is absolutely a new age war that has happened. And you see, the biggest worry that we see when we look at COVID, and I'm not going to go into the medical aspect of it, but what I want to highlight is, in the early phase of the infection, your immune system is strong. Then it goes into the lung phase, when actually it enters through the nose, goes to the throat, goes into the lungs, and then it starts to create the possibilities of breathing difficulty and other problems. And at that juncture, it goes into the cytokine storm phase, which it goes in only about 5% people. Remember, if 100 people get infected, 20 of them will have breathing difficulties, of which 5 of them will require an ICU, roughly. This is what you need to remember. So you cannot assume to say that agar mujhe ho gaya to kuch nahi hota. Agar 100 लोगों में से 20 लोगों में 20 people will get breathing difficulty, of which 5 will require an ICU. So again, not going into the depths of this, but what we are all worried for our children is, will it lead to over disease and will it lead to death? Is there a fear of all this? Now, one of the biggest things that has been spoken about is this thing called MISC, MISC. MISC syndrome is something that has been spoken about in multiple forums about children, saying that this is the one that has the potential to affect children. Now, what is this? It is called multi-system inflammatory syndrome, MISC. And this is what it's popularly called world over. And this has been seen in children quite a lot to actually get worried. And that's why the top virologists across the world are actually talking about saying that we need to be cautious about children, because this is the only group that's not going to be vaccinated. So MISC is a syndrome that can actually be caused in children and adolescents, which has persistent fever, markers of inflammation which are raised, and there is a sign of organ failure or dysfunction. Now again, not going into the depths of this, but this is something that has been used by the WHO and CDC. And multi-system syndromes have been known to be reported even in India. It has been reported well. Pediatricians have been talking about it. So I'm going to give you all a little bit of a cautionary observations that some researchers have made. I'm just sorry, I don't know how I missed this slide. Just give me a second. I just wanted to highlight on an important point of one of the, okay, here I am actually. I just wanted to share this note. Okay, here I just got the slides jumbled up. This was a very interesting thing to basically talk about. This is from the Journal of American Medical Association, Pediatrics, talking about the school reopening and the pandemic issue that is not getting its due. So there was a lot of debates for it, to say, why are we not opening schools? Our education minister has been very strong proponent to say that there is a lot of things we need to open schools, and what are the things. So I'm going to talk about, I spoke about the health angle. Now I'm going to talk a little bit about this angle. So the Lancet has again recommended that if you want to look at school reopenings, what are the things that you can follow? And I'm again going to share this with Shweta. You can use the slides. I'll share the paper also on what they've used. Primarily looking at physical distancing aspect, protection for staff and students, supporting for children and families under the broad heading. I'm not going to go into the details of this, but fundamentally we are talking about mask, we are talking about social distancing, we are talking about better ventilation, we are talking about hand hygiene, and we are talking about, if possible, improve the outdoor activities. These are the 5 core key principles that we are talking about here in this entire thing. And they're talking about biobubbles, trying to look at biobubbles in these groups. So a lot of researchers have spoken about this, and they've made some very interesting cautionary observations. And I'm just going to read those out to you, which I think were very pertinent, that keeping children away from school can affect their mental health and their education, but the long-term effects of remote and distance learning on both the scholastic and the social measures have not been understood till now. Students are beginning to feel the effect of social isolation as from a telltale signs of anxiety, depression. Parents are facing exhaustion, and children are finding it difficult to cope with dynamics of virtual learning. Student researchers say that many teens have dropped out of high school or dedicated not to go to college, and some of these may go back to school, many will not. and there is a lack of public response or even sympathy for these affected kids and young adults. So these were cautionary observations from scientists globally. And the key worries they had was school closure had a deleterious effect on children's health and deep impact on rural children. In rural children, especially, child marriages, child labor, a lot more of different dimensions from urban. And so the education minister has time and again often emphasized about understanding and differentiating urban from rural. These are two different, very complex aspects and approaches to education that we need to be dealing with. And these impacts are left with learning loss, reduced social interaction, social isolation, reduced physical activity, increased mental health problems, and increased abuse and exploitation. So these are some of the core things which I've kind of summed up in a nutshell. And based on that, the WHO came out with a very strong op-ed, which again, I'll share this article with you all, which shows that evidence from COVID-19 does not pose a high risk to children, and schools are not drivers of transmission. We know how to reduce the risk to children, teachers, and family. So this was a joint op-ed that argues for urgently working towards the reopening of schools. And I think these are some of the broader points that is currently going on in the global debate. I'm just putting forward some of the opinions that are happening at the global level. Yesterday, I was in this interactive meeting, and I'm just going to share this. I just put up this photo because the man here is Robert Gallo. Yesterday, we had a 2-hour long meeting with him yesterday. Robert Gallo is one of the world's most renowned virologists, based out of the United States. Constantine here is the US FDA a member for the vaccine group. We had open source pharma. Jai was there and I was there. This was a small group of meeting we did, and the discussion was around looking at children. And this top virologist, one of the globe's most renowned virologists, he was talking to us about looking at how do we protect the children, and we had some various interesting discussions as asking about how could we deal with the scenario. He had certain thoughts and exchanges. The primary thing I wanted to share here was, since this was fresh in my mind, I thought I'll share this. There's a lot of work going on to understand, can we create a stopgap vaccine to protect these children so that at least we can reopen and we can try and reboot education. Now, there's a lot of complexities involved. I'm not going to go into the details of some of these. I'm going to skip these. But what I wanted all of you to know is, we all know that the Delta variant was the cause of the second wave. We now know that there are 8,570 such new variants that are already in India. So what I wanted to tell you on a cautionary note is, please do not think that the war is won. This virus is mutating faster than what you can imagine. And the predictions are that the third wave, as the virus causes, it will be slightly 1.5 times more impactful than the second wave. So it's not going to get better, but may get worse. And if you think you've already had the infection and won't get it, that may be a wrong assumption, because the new strains seem to be making the vaccine a little less effective, as well as trying to look at a more aggressive course of things. So we need to maintain caution and not put our guards down at this juncture. So I had written this op-ed on genomic surveillance, and today we are very actively being a part of this genomic surveillance. We have our Lancet commissioner as a part of this group, and we've got a lot of active work going on at this juncture, and where we've highlighted about the aspects of why mutations are occurring and why this virus is so good at surviving. So again, like I told you, this is a new age war which is fought by doctors, not by soldiers. It was fought with soaps and sanitizers, not with weapons. It has to be fought with social distancing and not close encounters. And lastly, while we lose the sense of smell when we get infection, we can't lose common sense and get towards the COVIDiots, as what people call it as. Where somebody told me that there was a man who was carrying 2 boxes of toilet papers without a mask and with an arm around his friend's shoulders. You know, that's the classic definition of a COVIDiot, who misses the point of trying to hoard groceries and toilet papers, but forgets to follow social distancing and the basic norms of a mask. Now, at this juncture, I think it's pertinent for all of you to know and address that there is no good option. There is no perfect option. There are 2 bad options. One is sacrifice health or sacrifice economy, and nobody knows what to do. Political systems, guidelines, government bodies, international bodies are all in a quandary to say which side do you choose. And very few countries have actually given a balanced model. It's a complex model. and it also works on human behavioral dynamics. It is not just about a country passing a law. So countries like Australia who have actually, or New Zealand and Japan and others who have actually been able to give certain amount of shining light on balancing both of these, have expressed that there is a balance to do these two, but it comes with the sacrifice of both. A balance comes with the sacrifice of both. So that is what has happened through these things. So the aspects of psychological, economic, and behavioral impact cannot be ignored. Psychologically, social negativity, loneliness, depression, extremes of societal tendencies have been noted. Economically, we've had a fractured work culture, drastic cuts in production volumes, job cuts, pay cuts, and pocket cuts. I think crimes have increased. That's the level to which things have been spoken about. Behaviorally, we are, I remember one of my friends, a parent, telling me that my son's screen time has increased. I was the one who kept telling him, don't go on screen. And now I'm the one telling him, be on the screen all the time. And he goes from the TV to the computer to the video game to back to the TV to the computer. So he's kind of rotating in between all of these, with in between his screen time, and that's kind of reducing his physical activity, changing his behaviors. So there's a lot more complexities we are dealing with this at this juncture. I think this is more from the medical point of view that I wanted to tell you. The first three of this, that is trace, test, and treat, are the key, I would say, fundamentals for our approach to COVID. But teamwork and training are equally important here, and that also applies to the drills that schools will need to do before they reopen. And I think this is one of the very, very important aspect of school training that you'll need to build into protocols to understand. And I think the pediatric associations are going to have a very key role to play in this. I would also encourage that at this early juncture, you involve psychological experts, child psychologists, to kind of create an integrated forum to put this together. And I'll be happy to connect you all with relevant groups to put a structure to this. It's very, very crucial that all these three are being dealt with in a balanced fashion to give models. And I believe, let us not wait for the West to give a model to us. Let us give ourselves an example to show. And I would say that your group would be good enough, or anybody else should take up the lead to show how such models can be created in a systematic manner. I've always said sometimes that at this juncture, and this is for Anuj and Shweta, you need a pandemic CEO, somebody who actually delivers. And sometimes, there is no strategy. There is a stratagem. You need to win the war without fighting it. This is not a war you can fight for. This virus is smarter than us. So I've learned a couple of things. One is that I think we need to win this war at home or within the school barriers, but not in the hospitals. You need to remain productive. And I think this is going to be the biggest challenge that schools are going to face, on how do you improve productivity of children at this juncture. And there are a lot of articles in the Harvard Business Review that has actually come out in these lines, and I would urge all of you to go through those, on leadership during the pandemic time and how to improve productivity. I think you need innovative ways to kind of tap into the potential. And let's say that universe has thrown us this challenge. Let's take it up to look at how do we improve productivity. And also it's important for school teachers to get academically involved in writing papers on this. I think they need to publish these papers in editorials, into medical journals, to talk about how teachers can actually give perspectives to collaboration, productivity, and share equitable formulas of usage of such kind of innovative models to the rest of the world. Because we are somewhere assuming that the West will give us the answers. I think we need to go a step ahead, and we need to answer some of the questions and give answers to the West also. A reverse mentorship is a lot of thing that I have learned during this period, that there were no experts. So there was no one single expert who said that I know everything about COVID. None of them have been proven right. And reverse mentorship was a very good group. So I would encourage schools to actually conduct programs on reverse mentorship, where you ask the students on what do you think would be their perspectives on this. I mean, and you'll get very interesting insights into what they have to say. I keep interacting with kids, and I enjoy this time when I ask them, what do you think should be done for COVID? What are the things that you imagine about it? And it's just important to understand the children's perspectives on what do they think. Maybe they have potential solutions which we don't have or governments don't have. I think it's very important to tap into the intelligence of these young minds and ask them also. And we've seen this happen, that startups have been teaching corporations. We've seen younger teaching the grandparents how to use Instagram during this period. We've seen the students teaching the teachers, telling about how they learned some new techniques which the teacher did not know because they went online and they learned this. I think this is proof today. I'm not an expert again, but I'm talking based on the dipstick that I've been seeing in this work culture that I've been hearing from people. So I think there is a good case in time for reverse mentorship. And lastly, I think India will lead the way in conscious capitalism. I keep saying this, that conscious capitalism is an approach beyond just profit. It's about looking at profit with a purpose. It's about looking at understanding how can we sustain the economy at this current juncture by solving the problem and not persisting with the problem and going beyond GDP. I'm not going to go too much into vaccines and other things at this juncture. I think I'll open it up to questions, but I think there are a lot of leadership protocols at this time. So this is another op-ed I wrote on the pandemic CEO and what are the leaderships that we will need to harness. And this is the right time to build leadership in children. And you see, on an average time, many people are asking me about why we are not being able to pick up a treatment for COVID. It's just been a year. An average time from bench to bedside shows that it takes us about 17 years to develop a medicine like a vaccine. 17 years. Now we have done that in 1 year. So naturally, this is not going to be the perfect model, but these vaccines are here to protect and not to prevent. What is very important for all of us to understand is these vaccines protect, they do not prevent. These are under emergency authorization, and I think there are about 24 companies across the world right now who are ready with vaccines. They've done a phenomenal job. They've created a hyperloop in research. So they need to be applauded on this particular effort. It's not an easy task. And I understand that there is going to be criticism, there is going to be competition, there is going to be some amount of politics of pandemics in this, but beyond all this, I think they've done a phenomenal job. Each one of them have done and played their part. Some of them will succeed, some of them won't. But I think we need to applaud all of them, because if they all don't try, we will not have the solution. This is not going to be for the go-getter who says, I get the first shot right. We are going to face failures, and we need to celebrate our failures and the learnings from it, So at HCG, we were a part of about 6 odd important research. We did something on plasma. We've developed our own cytokine injections for COVID patients. We've now developed something on mesenchymal stem cell for respiratory disease. With the DRDO, we've developed a tool for artificial intelligence using chest X-ray, which can be done in rural areas. And we are looking at some genomic surveillance, which strand, and the Lancet Commission has been with Elsevier's helping us in a lot of endeavors. And I'm just going to close with this. I hope I've not exceeded my time. I just wanted to give you all a overview into what I thought should be a brief understanding about the subject. And like I told you, nobody is an expert, and nor am I, but I made an honest attempt to kind of put arguments and perspectives together at this juncture. So I'll open this up for any questions or comments at this point.
Yeah, Dr. Vishal. Yeah.
Thank you, Doctor. Yeah. We have had a lovely insight what you presented us with. We saw what schools will have to do. We are actually planning for that similar types that you had said, mask and social distancing, staggering of time, less of children in one batch and all that. Sir, Doctor, we have also had a few questions now, which are coming from our parents. So there is one thing which parents are asking is COVID in children a very serious concern, or children of 2 to 7 years already have a good immunity to handle the coronavirus?
So we did a little bit of a dipstick test in Karnataka, and what we found was in the age group below 5 years, the mortality has been 0.01%. Very, very less. So below 5 years we know, and now there is some rationale for this on why this happens. This is very important to understand that, and we had written a paper on this that was published some time back, saying that we have a gland called the thymus gland. This thymus gland is the one that creates the immune cells. It's just below the thyroid gland. And this thymus gland produces the immune cells. Now, this particular thymus gland is active in the mother's womb itself and is very, very active in children. It gets degenerated after 60, or in patients with comorbidities, it is less active. And that is the reason why the immune system is super active in children. And that is the reason why we say that children are very protected against this. And when we say majority of them are going to be protected. They can be carriers, but they are the ones that are actually going to be having the highest immune system in the age groups, because they have a very active thymus gland, which is very active and alert on the immune axis to understand and catch these viruses and actually destroy them through their immune system.
Okay, okay. That was quite informative. And yes, the CFR, case fatality rate in the children are very, very low. But yes, parents are always apprehensive and they have a lot of questions. And one of the questions which parents are always are asking, and we also are counting on it, is that how far are we from vaccination for children presently? How much time it will take? Would it be successful for us or not? How would children react to it? How far really we are for a vaccine for children?
I want to sound optimistic, but at the same time real. It's a very difficult task. Like I told you in the previous slide, I showed that slide to kind of describe to you how long it takes. And children is a very complex thing. Global bodies are working on this. Typically, it takes a couple of years. So the first group that they wanted to work on was the above 60, because that was the most vulnerable for death. So they've, I think, made some headway there, and they've actually been able to save millions of lives because of this. The age group of 18 is a priority age group, and that is what yesterday Robert Gallo was talking. So he'd written a paper on aspect of looking at repurposing oral polio vaccine to save children, which means that rather than waiting for the next vaccine to come in the next 1 to 2 years, let's look at repurposing some of the existing vaccines and seeing if it can be done. These are at an investigational stage right now. We put some proposals to Government of India to reconsider this, and we hope to get some answers on this. And if this is helping, we're going to be able to maybe give a stopgap vaccine. In the meanwhile, there are clinical trials ongoing, and we believe that in the next by the end of this year, we will have some clear answers on this. But this year is going to be a testing time. Like Sputnik has come, and Sputnik is protecting from the age group of 12 to 18. You can use it. So Sputnik is partly solved the problem for the age group from 12 onwards, and below that they have not studied yet. But Sputnik has got an efficacy of about 92%.
That's correct.
So we are already, I think, covering the thing phase by phase. So hopefully in the next coming months, by the end of this year, we would have had tangible solutions for this.
Okay. So, Dr. Vishal, next question from the parent is, till the time vaccine is not there, what kind of a precaution they should do with their kids so that they should not get an infection?
So, like I said, there are 5 things which I repeated earlier. We healthcare workers lived without the vaccine for 1 year in the COVID ward. At this juncture, it's important that your mask is your first vaccine. The second, I think it's important to teach children breathing exercises. You call it yoga, you call it anything, teach them good deep breathing exercises. This is the best time to teach them this discipline. And that will help them a long way, because even if they're wearing the mask, it is important to encourage them for deep breathing. Because what I've seen is that a lot of these children are shallow breathers. They don't learn the knack of deep breathing. It's very important that abdominal breathing is taught to them very early. In 1 minute, we are supposed to take 12 breaths. Teach them to take one good breath at least in a minute. So that, there is this debate about whether less than 5-year age group children need a mask. There's no clear evidence as of now, but it's just that behaviorally it's complex for these children. That's the reason we tell that this particular age group is going to be more prone for breathing difficulties. They won't breathe proper. I think we need to teach them basic techniques of breathing, which need not be a very complex yoga technique, but the simplest of deep breath, abdominal breathing should be taught to them. And above 5 years age group should be encouraged towards wearing masks. And this way, the simple 5 formula that I'm reiterating: number 1, priority mask. Number 2 priority is indoor ventilation. Number 3 is going to be social distancing. Number 3, outdoor activity. And number 5 is going to be your outdoor activity. So these 5 things are going to be crucial. I'll repeat: your mask, your social distancing, indoor ventilation, outdoor activity, and social and hand hygiene. These 5 things are going to be very, very relevant for us to practice and discipline the children, because this is something that they will require till at least end of 2022, because this virus is not going to go away.
Doctor, there's another question about the annual flu vaccination. So, will that provide any protection from COVID infection? And should the parents get it done, or is it delayed? So, should they reschedule it and get it done on priority? The annual flu.
I've been talking to a few pediatricians on this, and I think my opinion on this is, remember that influenza shot does not give you protection against COVID, number one, but it does give you protection against apprehension of the influenza coming up and you thinking that it is COVID. That's all. So you need to talk to your pediatrician. Influenza vaccine is for influenza infections, which can also produce the same kind of upper respiratory things, and you may start getting worried and paranoid, saying, "Oh, COVID aa gaya." So if you want to take that, take it, but that's only for influenza. Don't think that COVID is going to be protected from this. But yes, it does reduce apprehension for you, because a lot of false alarms have been happening of people trying to book a bed before the thing happens and saying kuch hone wala hai, kind of a thing.
Understood. Doctor, you mentioned outdoor activities. So nowadays, how parents can do outdoor activity with the kids. So can you put a light on it? Because right now lockdowns are there and many parents have asked that. So how to increase the physical activity of a child?
I've been trying to figure out, there's no one single formula, but I think the determination to say that the child will be physically active, do not make him use the lift, make him use the stairs. Even if children are there, the apartments have made norms to say that beyond so many children cannot be put in one place together, and they should be doing their games and activities which encourage social distances should be encouraged, and each apartments or schools can give some guidelines from their side on, like Kids Castle can come up with some suggestions from your side about what are the games that you all should play which encourage social distancing rather than close counters. And look at, this is a great opportunity for us to bring discipline among children through these measures and telling them that government is enforcing it.
Okay. Fine. Dr. Vishal, one question we touched upon during your conversation was on creating a bubble, right? A kind of a bubble where we can protect our children. We as a preschool or any other school, how can we create a bubble for children, and what kind of precautions shall we should take to ensure that the bubble is not broken and keep our children protected from COVID?
The biobubble concept is purely based on behavioral patterns, and preschool is a very complex place because these children, while I am confident at their capabilities, but yet, that age is not the most apt age to enforce such things, because they tend to kind of get into close counters, they play, there is the physical proximity. So these are things that cannot be avoided to a certain extent. But I think what's important is smaller batches of schools. I'm seeing smaller batches of schools wherein each teacher will be divided into 5, 10 minimalistic groups, where that it's easy for the teacher to kind of to maintain social discipline among children and keep a close watch. A teacher, even online with 30 students, will not be able to manage all the 30. So we may have to reduce the number of classes or increase the number of gaps and ensure that smaller groups are created. It may not be the most optimal, but it's a good trade-off. But that way, these bubbles can be created with smaller, and that way, y'all can, as an association, go back to the governments to ensure and show these models and say, we will follow these COVID appropriate models that will allow certain of them to slowly start. And I think this is the need of the hour, that if we are going to expect the government to solve it on its own, it may be difficult, but you will need to come up with such kind of innovative solutions and show that we will create smaller biobubbles wherein there's going to be appropriate discipline among children. Although it may be in batches, it may be not like the regular stream of the classes that happened before, but at least it gets the ball rolling. And that also gives assurance to the parents to say that they are safe in their own thing. So if they travel in their vehicles, reach the particular place, and there, I think there's some place for us, some hope to start with, because I know there is no one single answer to say that this is the one formula that fits everybody to say start off all together. And that's why governments can't take that decision.
Doctor,
Yeah.
if parents are vaccinated, does that give children the extra protection against corona?
So it again depends, like I told you, on two important principles. One, that COVID vaccines give protection, not prevention. That means it does not reduce your chances of getting your infection, because you need to continue to wear your mask. So you'll need to continue to wear your mask even after getting vaccinated. If the parents are all work from home, it's a different thing. But if a parent, like I'm saying, I'm a parent today and I'm sitting in the COVID wards, I'm sitting in the fungus wards, I'm sitting in every place. And when I go back home, what do? I think my family is at risk. So I have taken certain key measures in my house to ensure that because I'm going out and I'm coming in, I'm wearing my mask, I'm maintaining my social distancing, I'm taking precautions to keep a separate room. I maintain my height. These are very, very crucial. So I think the dynamics of what these parents do is going to be crucial here to ensure. And there are instances where the kid has brought the infection and given to the parents. The kid is super active and the kid is the one going down to the basement, to going down into those weird corridors where nobody else goes, and that is the place where this particular viruses are actually locked because there's no ventilation. So he may be the one who's the virus donor for the parents. So what's important here is the activities here have to be with a lot of caution, with a lot of discipline to the children, to tell them that each one of us are vulnerable. Children are great carriers. They have profound immune system, but that can be transmissible to the grandparents who are more, whom it may be more lethal for. So if the grandparents are vaccinated, they're definitely protected. But it's important to understand that these vaccines can give protective in 80 to 90% of the people. 10% will still be vulnerable for a significant disease.
Okay. I have a question that, a lot of parents and, us also, we try to give some amount of medication, like we are giving zinc supplements or vitamin supplements, or giving some kind of Ayurvedic kara also to children. Does that really builds up the immunity in children? Is it really required to be done, or COVID virus has mutated so much that it will bypass everything and still infect a child no matter whatever we are doing from our?
You see, I have many people, when we discussed in various forums, have asked me about what is that formula for immune system. There are three things that I can say. Number one is your nutrition and diet. That means high protein, low fat, moderate and good amount of fibers, very low sugars, with vitamins, minerals, and with vitamin and minerals in a balanced, natural proportion. Sprouted vegetables, green leafy vegetables, fruits. This is what we will need to focus on, not supplements and medications. So, with the adage of the old saying that your food should be your medicine, not medicine should be your food. Do not believe in this hearsay that that there is one magic formula, that this medication, vitamin C every day mein lunga, with this supplement with chamanprash and mixture of this particular thing and one Ayurveda concoction put together is giving me one immune formula. It may, I am not saying it doesn't, but that does not prevent you from this virus. This virus is much stronger than your immune system. And this happened in India because at first in India we thought that we are different from UK and USA. हमारा immune system अलग है, क्योंकि हम लोग पानी पूरी खाते हैं, हम लोग रोड साइड ये सब खाते हैं, तो हमारा immune system बहुत अलग है, हम लोगों को कुछ नहीं होता. Then we had an argument that नहीं, कर्नाटका अलग है and महाराष्ट्र अलग है, तो हम लोगों का थोड़ा अलग stronger है. We did this. So I'm saying that this is completely wrong. We were proven wrong by statistics telling you that, look, don't do this. There was one discussion where I was called, very unfortunately for that panel discussion, where some people were smearing cow dung on themselves, thinking that protects COVID. And they asked me, can you comment on this? I said, I don't know what to comment on this particular scene. There were some 30 people standing and smearing cow dung on themselves and saying it prevents corona. So I said that, I had to be giving a very balanced view. So I said, I don't know why they're doing this. corona enters through your nose and goes into your lungs, and there has been no studies that have tried using cow dung on the lungs. So I don't know at this juncture to say whether cow dung works or not. I mean, I don't know. My point is, I'm sorry, but these kind of experiments in India will keep going on, where somebody will come up with this new crazy radical idea of trying to do something absurd and saying that that will prevent. And many of them have reached ICU after doing all of these stunts. So the point is, one thing is that till now, nobody has been able to solve it. WHO is getting confused every day because every day one new claim comes up saying that, yeah, this is the one, like ivermectin is doing the magic. But finally, time and again, we found that they may help, but they do not supersede the power of the genetic power of that virus. So at this juncture, yes, we need to keep our immune system up. The first thing, diet. The second thing, good amount of fluids and water. And the third thing, good amount of oxygen. If you do these three, which are free, and at least which of them are easily accessible to us within our own homes, I think that's good enough. Do not waste money or time on anything else to say that I'll buy this and that is the one that is going to help you. If you are practicing something, do it in terms of your immune system to say that I take these supplements. But remember that that is for most of your satisfaction, and there is no data today to tell you that using this is going to prevent you from this particular infection.
Okay.
Doctor, one more question. The symptoms in children, are they going to be different from adults, or it is going to be similar?
Similar symptoms, shorter duration. What we have found is similar symptoms, shorter duration. Remember that when the virus enters into the nose, it produces loss of sense of smell. It goes into the throat, it produces throat irritation, soreness kind of a thing. Then it gets into the lungs, it produces cough. And thereafter, it can produce breathlessness, or it can produce, when it enters into the blood from the lungs, it produces fever and sustained fever. So by the time you have got the symptom, it means the virus must have entered 5 to 7 days before.
Right. Do we have any other questions, Ma'am?
Yes, I think we have. Sir, doctor, you had touched upon food and balanced diet. So parents are still apprehensive about what food are you talking about. Can you just give a little more explanation on a balanced diet or a nutritional diet that children should have?
I think most importantly, packaged foods are less sources of nutrition in general. If it's preserved packaged foods, try to give as much of natural food, even fruits, vegetables, mashed things. I know sometimes it's difficult to enforce this to children because they may prefer a pizza burger to a nice vegetable meal. But what's important, I think, at this juncture is to induce discipline in children. It's a great opportunity, but it's a tedious task. But I think if schools can also play a role in this to ensure that the schools are asking them that you are doing this like a homework, I think it is going to play a reinforcing role to these children to say, I have to eat every day one plate of fruits. It can be oranges, grapes put together. And the school has told me that this is one of the homeworks that I'll have to ensure to do. So make this as a part of this thing so that they are eating well and they are monitoring of it, because sometimes it's difficult for parents alone to enforce this. So if schools can also take a part in playing this role of building a simple timetable for these kids, it will help them to build a more balanced diet at this juncture.
Done. Okay, Dr. Vishal, will add that definitely. One last question is there. How wave 1 and wave 2 was different if we consider kids infection? So how it was differently for the kids? More kids were infected or it was the same?
No, more were infected, in fact. More were infected. And remember that the first wave was caused by the D614G, the first strain that came in. The second wave was caused by the 617.2 Delta variant. So every wave seems to be caused by a new strain that seems to be more aggressive than the previous one, because of the logic of what I told you, that something that does not kill you will make you stronger. And this virus seems to get stronger by every strain, by new variant that it is forming. So it's very important. That's why that children do not let their guards down. But at the end of it, we need to remain productive. We need to remain active through collaboration and keep continuing this game, because this is going to be a long haul game.
There are a lot of questions being asked about the use of sanitizers. So now parents want to know, is it okay if the children are completely, they start playing with the sanitizer, so they put it in their mouth. Is it okay for them, or should this
I
be
think
implemented more strictly and more disciplined way?
the most important thing here is what studies are now showing is fomites are a less transmissible way for the virus. So what we earlier presumed that we were washing the walls, we were cleaning the doors, we were doing all these things, cities were being washed. Today we know that fomites are a less way of transmission of the virus. The aerosol way, the air way is the more easier way, because currently we know that earlier we thought that it was droplet infection. Now we know it's aerosol spread, especially because of super spreader events. That means it was found in AC vents. It was found that when a person was in one room who was COVID positive, another person in another room who was isolated from him got the COVID infection, and there was no way that he could have coughed from that room to this room. So these are all studies that have been published in the Lancet that have shown that aerosol transmission is currently happening by the virus, which means it's traveling through air to a certain distance and can live in one place for up to 3 hours. So it's very important to understand not fomites, not touch of things, but it's actually air that is the more bigger cause of it. So while they enforce sanitizers, encourage hand hygiene, it's also important that ventilation should be given more importance than hand hygiene. I'm not saying to play the other one down, but understand that don't fear about the other one so much, because there's not much of data to show fomites are transmitting it as much as aerosol.
True, ma'am. And in fact, I would personally say that instead of sanitizer, one should wash hands with soap, right? If the children are putting in their mouth or in their eyes, use soap. That's much better.
It's a logical explanation, because that way you're maintaining hygiene, and this one, don't use too much of sanitizer unless it's urgently required or something like that. Keep diligently encouraging them for hand washing.
True, true.
And I would also urge that if Kids Castle can actually take up some kind of mass communication flyers or other things which you can keep communicating with them, which they can put on their desktop or on their thing as a wallpaper, so that these are messagings that they can keep giving as reminders for their children. So during their classes, on their wallpapers, you can keep this hanging so that they keep reminding themselves to say that this is the 4 things that I have to do.
No, that's an excellent idea. Probably we can definitely do that. We can definitely do that.
So Anuj, you have been teaching me good points, man. I think after Shweta's discussion, I've learned a lot.
Yeah, we have actually learned a lot. In fact, so many things have come to us, and parents were actually asking this question about nutrition, about health, how to take care of children, about the bio bubble which you have talked about. We would try to do some kind of experimentation, getting children physically to the school. A lot of homework for us, definitely we'll work out on these points.
How I can connect you with the social science behavioral experts who can help you all. There are some experts in this area. I'm going to talk to them today, and I'll connect them with you, so that you all can actually, on a more formal note, take their help and assistance, and after that also share those suggestions with us, and maybe I'll be able to recommend this to the government and put this across.
Sure.
That would be great.
I think there's one more question, because we have spoken a lot about masks. So now there is this question: any side effects of continuous usage of masks? Since we will ask children to put it out, parents are asking them whenever they go out, they have to put masks.
The biggest concern is no breathing. I think you need to encourage breathing, and that's why I was emphasizing on one is safe and sanitized or hygienic disposal of mask, not touching the mask all the time, and not to use it as a chin guard, and keeping your nose open. So the most important discipline is to ensure that they continue to use their mask in the right way, and during the usage of the mask, continue to breathe. Keep the discipline of breathing on with them, and hygienic disposal of it or washing of it if they're using the cloth mask.
Okay.
There's too many questions, and parents are very happy we were able to answer them. Thank you, Dr. Vishal Rao. That was a very insightful discussion. And I hope this discussion will help us in furthermore. Sir and ma'am are there. We'll keep guiding our parents and teachers, and we'll do whatever is required to do best in the best interest of our children.
Thank you.
Thank you, Dr. Vishal. Thanks a lot for your inputs, for your guidance. We'll definitely follow most of the things what you have said. Thanks
you.
a lot, sir.
Shweta. Thank
And
you.
I'll, sorry.
Thank you very much.
Thank you, Shweta and Anuj. And Simple, thank you very much.
Okay, sir. Thank you. Bye-bye.